After William Harvey's discovery of blood circulation in 1628, physicians started to experiment with blood transfusions between animals and humans. The first recorded successful blood transfusion occurred in England when physician Richard Lauer kept dogs alive by transfusing blood from other dogs. In 1667, Jean-Baptiste Denis in France and Richard Lauer in England separately reported successful transfusions from sheep to humans. Interesting. Because blood clots, when exposed to air, these transfusions were performed along a longitudinal tube. Due to the lack of knowledge surrounding blood groups and coagulation pathways, many of these early transfusions were unsuccessful and caused the death of many people. Within 10 years, transfusing the blood from animals to humans became prohibited by law because of the adverse reactions. In 1795, in Philadelphia, American physician Philip Snigg performs the first human blood transfusion, although he does not publish this information. In 1888, James Blunder, a British obstetrician, performs the first successful transfusion of human blood to a patient for the treatment of postpartum hemorrhage. Using the patient's husband as a donor, he extracts approximately 4 ounces of blood from the husband's arm and, using a syringe, successfully transfuses the wife. Between 1825 and 1830, he performs 10 transfusions, 5 of which are successful, and he publishes these results. In 1867, English surgeon Joseph Lister uses antiseptics to control infections using transfusions. And in 1884, saline infusion replaces milk as a blood substitute due to the increased frequencies of adverse reactions to milk. And in 1900, Austrian Karl Landsteiner, what a legend, he discovers the first 3 blood groups, A, B, and C. Blood type C, as you all know, was renamed to blood group O. And he eventually wins the Nobel Prize for Medicine for this discovery in 1930. And then in 1912, Roger Lee develops the Lee white clotting time. He also demonstrates that it is safe to give blood group O to all patients, and it's also that all blood groups can be given to blood group AB patients. And then this is how the term universal donor and universal recipient were coined. And then, in 1939, 1940, our boy Karl already won a Nobel Prize. He didn't stop there. Continues his research, and together with some colleagues, he discovers the RH blood group system, which is then, recognized as the major cause of transfusion reactions. And then in 1945, Coombs, Morant, and Race described the use of anti-human globulin, which becomes known as, the Coombs test, to identify incomplete antibodies. And in 1971, the hepatitis B surface antigen was being implemented in testing for donated blood. And then if we go to 1985, then that's when we get blood screening. The first blood screening test to detect HIV was licensed and quickly implemented by blood banks, worldwide, to protect the blood supply. Again, obviously, there was blood that was coming in before then. So, in 1998, we had the Look Back campaign, which is a public health effort to alert anyone who may have been exposed mainly to hepatitis C through blood transfusions before 1992, so that they could, receive the proper medical counseling and treatment if needed. Yeah, that's a brief history of transfusions.